Hello, everybody. Thank you for attending my session in this section. My name is Michael Mensa. I'm a assistant editor at JAMA Network Open, and today I'm presenting my team's work entitled "Equity, Diversity, and Inclusion Concerns" from JAMA Network peer reviewers. You can see on my slide my disclosures. There we go. Okay, so benefits of EDI in peer review include improved scientific quality by undermining groupthink, increased innovation and creativity through interdisciplinarity, and greater trust and legitimacy through increased transparency. These findings are based on a report commissioned by the National Academies of Science and Medicine in 2021. Dangers of ignoring EDI in peer review are not only the absence of the aforementioned benefits, but also the risk of publishing prejudicial science, such as this article published in the Journal of Vascular Surgery in 2020, entitled "Prevalence of Unprofessional Social Media Content Among Young Vascular Surgeons." Both the previous and current JAMA Surgery editors-in-chief discussed the article soon after it was published. The article, which claimed to assess unprofessional social media content among recent vascular surgery graduates, found only 3.4% of content analyzed was clearly unprofessional, much less than other specialties. However, only 1 of 7 authors was a woman, all data abstractors and article reviewers were men, and the article's analysis and commentary was implicitly biased with an overemphasis on negative outcomes concerning women and other minorities. Accordingly, in March 2023, the JAMA Network invited peer reviewers to check a box when concerned about elements of equity, diversity, and inclusion. The network also invited reviewers to explain such concerns and confidential comments to the editor. As you can see, the question text asks reviewers to consider EDI in terms of framing, methods, terminology, inclusive language, or representativeness. As such, in this study, our objectives were to first examine peer reviewers' use of the EDI concerns checkbox, and second, to categorize concerns described in confidential comments. To accomplish this, we have examined all reviewed manuscripts for each of the 13 JAMA Network journals from March 2023 to December 2024. For each journal, we reported counts and percentages of peer reviews for which the EDI concerns checkbox was marked yes. Using JAMA Dermatology as a case study, we extracted EDI comments from reviews and then used rigorous and accelerated data reduction, or RADAR, to analyze the comments. Briefly, RADAR develops all-inclusive data tables, then iteratively reduces those tables until only research question relevant data remain. 2 authors, including myself, classified comments as EDI relevant or irrelevant using RADAR. Then we coded comments, agreed on coding, and finally distilled prominence categories among all comments. See the bar chart here. I swear I didn't use AI to make this. Regarding results, among 39,151 manuscript reviews across all JAMA Network journals, 2,075, or 5.3%, used the EDI concerns checkbox, including 5.5% of research manuscripts. JAMA otolaryngology reviews had the lowest proportion of checkbox utilization, with 2.6 overall and 2.7% for research manuscripts. JAMA pediatric reviews had the highest proportion, with 8.1% overall and 8% of research manuscripts utilizing the checkbox. JAMA dermatology reviews used the EDI checkbox at the median frequency, 4.8%. Using JAMA dermatology as a case study, among 91 JAMA dermatology reviews using the EDI checkbox, 31, or around 34%, had confidential reviewer comments deemed relevant to EDI. Regarding those comments, categories of concern included lack of clarity regarding race and ethnicity categories, which took up 48% of relevant comments, statistical or methodological concerns, which took up 1/6 or 16% of comments, skin tone representation, which took up about 10% of comments, ambiguity in language around demographic identifiers, which took up about 10% of comments, and inappropriate use of gender ascribed by observers, which took up 6.5% of comments, or about 1/16. With regard to conclusions, we concluded that reviewers infrequently use the EDI checkbox, and that among JAMA dermatology reviews using the box, less than half made EDI relevant confidential comments. The content of those comments were similar to those raised by the American Academy of Dermatology, whose concerns included issues of race, ethnicity, gender, and skin tone representation. Limitations of our study include the fact that we cannot comment on how sensitive or specific EDI box checking was to actual EDI results in the manuscript, or EDI issues in the manuscript, or on manuscripts without comments to the editor. Future work could explore soliciting EDI concerns from reviewers and assessing and addressing EDI concerns before publication. Thank you, and open for questions.
Thank you, Michael. Any questions?
Yes, Michael, thank you for the information. I just want to clarify.
Can you
Yes,
identify
sorry.
yourself?
My name is Paul Cooper. I'm with the Electrochemical Society. I'm the editorial manager. When you are referring to the comments that were provided, this is on the subject matter of the paper, not the authorship of the paper. Is that correct?
So it's hard. I would say it's hard for me to say explicitly. I would assume it's the manuscript that was of concern.
Okay.
The EDI instructions were those that I listed in the slide previously, and reviewers could interpret that however they saw fit. So I think most of the time it was likely manuscript concerns, and we did not see any mention of author-related concerns in our review of comments.
Great, thank you.
Yeah.
Hi, Matthew Goldrick, Northwestern University. I don't think this is part of the study, but I was wondering about your editorial process and how information from these checkboxes is incorporated into the peer review. Are there explicit instructions provided to editors about how to utilize that information or when to utilize it?
Yeah, I'm just an assistant editor, so that's a little bit above my pay grade. But what I will say is that the signal that the EDI checkbox created when the reviewer checks it is then sent to the EDI editor at each of the 13 journals. So that EDI editor has discretion as to how they want to handle the issue, especially if it's explained. And the process goes from there. I'm sure there's some variation among journals as to how each of the boxes is handled by the editor. So.
And just as a quick follow-up, is the EDI editor distinct from the action editor for that particular paper, or is that a parallel process that occurs?
I think it's a parallel process. I think most of the time they are distinct, but I think that would vary by journal. Okay. Again, I'm not speaking for JAMA, way above my pay grade.
Yes. Thanks.
Okay, so we'll take a question from the back over here on the left, my left.
Thanks very much for the great presentation. So just a question about the methodology outcome that the reviewers could check off. So can you say a little bit more about the kinds of methodological they had? Did it have to do with studying subpopulations appropriately and making sure people were categorizing it appropriately? Did it have to do with confounders related to structural variables and explanations? Like, was it related to EDI concerns?
Right, that's a great question. So I think generally there is some variation in what was deemed to be methodological. I think one point that you're making is about the schema that are used to identify people racially or ethnically. Some of them did not use the Office of Management and Budget standard schema or question choices for identifying someone by race. So that was brought up as a methodological concern. I think the power, issues regarding powering studies and the of categorization affecting that ability was also an issue. So that was brought up as well. And then I think in general, racial and gender essentialization or attributing outcomes solely to race or gender without socializing the result was also a methodological concern brought up once. So just a few examples.
Michael, nice paper. I'm Steve Finn. I'm also from JAMA Network, so might be an inside baseball. I've got a question and a comment. The one comment would be looking at the portions or percentages by journal, may also relate somewhat to the number or proportion of articles which those journals tend to publish on issues related to race and diversity and so forth. So it would be interesting maybe to also look at that as a proportion, since we do classify articles into those categories. The question is, and I realize this was not an outcome of your study, but just a general impression, whether you and your co-reviewer of those articles tended to agree or necessarily maybe disagree sometimes with the concerns raised. I mean, what was your overall impression? Did you find yourself saying yes, 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 or did you not actually sort of look at the articles and try and decide if those concerns were, consistent with what you thought they should be?
Right. So in reviewing the comments, we stuck solely to the comments. We did not go into the articles to verify or check whether the concerns were correct, since neither I or Adnan, the other reviewer, are dermatologists. So that could have been a barrier. That said, when we were trying to agree on codes, we generally agreed on the 5 large codes that we got to. We had slight disagreements on how we would describe the issues, whether they would be methodological, whether they would be about one's approach to getting to the conclusion, the soundness or the construct validity with regard to race and ethnicity. We had questions about that, but the larger categories, we did not have much conflict. I think that probably 1 out of every 4 comments, we had a robust discussion.
Over there, please.
The intervention in your study is focused at the reviewer level. To what extent do you think a journal should depend on reviewers to be flagging these issues? And to what extent do the journal editors need to have the skills and cultural competence to be able to pick up these issues on their own? And I would note that JAMA has been a world leader in setting standards for proper scientific reporting of EDI issues. Shouldn't all editors of JAMA journals be able to pick up on these issues without having the reviewers to prompt them for it?
In a word, yes, for sure. I think, speaking only for myself, I would say that redundancy is probably the best approach of having reviewers and editors observe these issues. I would say, in general, it's helpful to have people from different perspectives look at and see and make sure that EDI issues are not popping up in a paper. As spoken about with the Journal of Vascular Surgery, there's at least 3 different levels of evaluation through which that manuscript got through despite its issues. And so I think there's 2 issues you're talking about, which is redundancy in the process of detecting errors and issues, and also a general overall sense of responsibility with regard to a manuscript being at least culturally competent, if not, culturally, structurally, and in other ways competent to EDI. So.
Are there any questions from the virtual world? None. Okay, so we still have a few minutes, so I'll pop a question here. Does JAMA enforce SAGER guidelines, and how do you think SAGER sort of talks with your checkbox and your concerns on EDI? Do you know SAGER guideline? Oh, sex and gender reporting guidelines.
Okay. Oh, sorry. There are certainly, so in our study, we did not look at those guidelines and use them to determine whether or not they were met in the comments. So at least in our study, that was not the standard that we use. And I have not seen a guide necessarily that at the time when the articles were implemented or being reviewed that abided by those standards. That said, I wasn't part of JAMA at that time, so I'm sure there is a guide. I'm sure, and that has done a great job of putting out a guideline for that. So, with regard to this study, I do not recall guidelines being used as a standard, but reviewers could have had that knowledge.
Please.
JAMA Network. Yeah, we have guidelines for reporting on sex and gender. They preceded the SAGER guidelines. We do also are aligned with the SAGER guidelines, and we are in development of updated guidance for reporting of sex, gender, and sexual orientation to be released soon.